The problem with perinatal OCD is that it is often misunderstood, it's misdiagnosed, very often confused with things like perinatal anxiety or depression, or even psychosis. It's mistreated because if you can't get the diagnosis right, you're definitely not going to get the treatment right. But most importantly, it's missed. The charity OCD Action UK, they have done some research and they've shown that it takes on average 12 years for somebody who's suffering with OCD to actually tell a health professional about it, on average. In clinical practice, I've seen double that. I've seen people in their 40s, 50s, and 60s coming for the first time asking for help with the OCD that they've been managing on their own in secret, essentially, their whole life, or maybe with the collusion of friends and family.